Failed spine surgery is just that, a spine surgery that failed to help the patient the way it was supposed to help. Even though it failed, there are additional treatments that you can still get. First, we must determine why the original spine surgery failed. There are various types of failure. It could be that the pain the surgery was supposed to help didn't get better. It could be that some pain improved, but a lot of pain did not. For example, the sciatica improved after surgery, but back pain persisted. Or it could be that a new pain was caused by the surgery. It could be that the deformity of the spine did not get better, or it could be that there was a fracture or failure above the surgery location. In some cases, we might see that a fusion was successful, but it led to further deformity and worse problems. Remember, the spine is made up of 29 bones separated by discs with nerves going through the spinal canal and ligaments supporting the spine. It is supported by a variety of muscles holding it up in a dynamic balance. There is a complex interplay between the bones, joints, muscles, and nerves, and this generally makes it challenging to diagnose problems and treat them correctly. Thus, one of the reasons for failed spine surgery is treating the wrong area. Back pain can come from the disc, the facet joints, the nerves in the spinal canal, the SI joint, or the muscles of the back. It can even be from psychological causes. Thus, if a laminectomy is performed because the pain was thought to come from the nerves being compressed in the spinal canal, but the pain was from a different source, that surgery won't help. Even if the nerves were compressed, but the cleanout did not successfully reach all the way out to where the nerves exit, this could result in a failure as well. Here's an MRI of a patient with stenosis way out in the foramina. This is a hard area to decompress surgically and sometimes requires a fusion. Thus, if only the central canal is decompressed, the nerve compression might persist. Similarly, if a spine fusion is performed for back pain, but the pain is coming from the SI joint, then the pain won't get better, and might even get worse. Sometimes I see a fusion that looks okay, but no one has actually investigated why it still hurts. Here's an x-ray that looks fine, and the patient was told the fusion is fine, and the pain is all in your head, and I did a good surgery, it's your fault you still have pain. Well, when we simply look at a CT scan of the same patient, we can see that the bone has not bridged across the disc space. And if we look closer, we can see these halos or gaps around the screws. When we revised this patient's fusion, she had complete relief and was able to go off of all of her pain medications. Here's another example of a patient who had multiple fusion surgeries, but was not well balanced. Surgeons kept fusing up the spine 1 or 2 levels at a time until she completely failed to heal and the rods fractured. With the right realignment surgery and the right rebalancing, we could get her standing up straight again, and we achieved a successful fusion because the spine was properly balanced. This becomes a complex surgery of cutting the bone and realigning the spine, but that's sometimes needed to convert a failed spine surgery into a successful outcome. In this patient, surgery helped her leg pain, but she continued to have back pain. To her, it actually felt like new back pain started after the surgery. However, surgeons told her that everything looked okay, even on the x-rays. When we investigated with a CT scan showing 3D images, we found a fracture. We injected this area as a diagnostic test and found that it was really the source of the pain. Finally, in this last patient, the fusion surgery did not successfully achieve a solid fusion. When she complained of continued pain, her surgeon took out 2 of the screws. This left her with even less stability and still no fusion. When we revised her surgery and treated this source of pain, she was able to get much better. So overall, there can be a variety of causes for failed spine surgery. The key, though, is that if a surgery is not successful, then it's important to look for the source of pain and treat that source. The vast majority of the time, we are able to isolate a clear cause of the pain and treat it effectively. If you had an unsuccessful surgical outcome and have been told that there is nothing wrong, it might be time to get another opinion.